province has moved a midwifery program from the Royal Alexandra Hospital to the Fort Saskatchewan Community Hospital, raising questions about access to midwife care. Now, while the province says the number of midwives in Alberta is growing, the association says 40% of Albertans who apply for midwife care are unsuccessful. Now, joining us is Mama Nurse Tina, all dressed up in red. Thank you for getting my memo.
Unagi.
yeah, that's right. So what kind of impact could moving the program to Fort Saskatchewan have on this province?
Yeah, so right now when people go into the Royal Alex to see a midwife, they're going to be met at triage if they're being sent in from their community midwife, and then that midwife at triage is going to be able to help them to get the assessments that they need or any other services. So now moving that to Fort Saskatchewan, a lot of that front work is going to be actually done by like the nursing staff at the Royal Alec or the obstetricians that are there. So it's going to be putting more pressure on the nursing staff that's at the Royal Alex to see those patients. They will still be able to deliver with their midwife at the Royal Alex, but the care that they receive moving forward, things like induction of labor, any assessments or any consults with obstetricians will have to be done with other staff that work at the Royal Alex as opposed to the 24/7 midwife that supports community midwives.
Okay, so if somebody's looking for midwife care, what other resources are out there? What's your advice?
Yeah, so I mean, I think it is amazing to have a whole system at the Fort Saskatchewan Hospital. Typically, midwife patients are low risk, uncomplicated pregnancies, and so midwife care is incredible for them. And so being at the Fort Saskatchewan Hospital, that's great. However, when you're looking at sort of logistics and you're looking at demographics, Fort Saskatchewan's a lot farther from the Royal Alex Hospital. Yeah. So if you have people who are, in labor and they're looking to be with their midwife and they might not have that time to get to Fort Saskatchewan, that's going to impact it as well. Or maybe they just can't make it out there. So I think instead of maybe an or situation where we have something at Fort Saskatchewan or something at the Royal Alex, we probably should be looking at an and situation because it would be way more serving to our communities to have both Fort Saskatchewan and the Royal Alex to sort of help all of the city area.
Okay, so let's switch the topic to social media, right? Because when people, couples get pregnant, especially the women, they're looking on TikTok and Instagram for advice.
Yeah.
What are the pros and cons of this?
Yeah, so now we're seeing studies coming out that about 40% of people are actually going to social media for their medical advice. And it can be incredible. And that's kind of the reason I think why people are going to be moving to midwife care, because they're learning about all of these things on social media. Kind of a double-edged sword, though. So lots of great information, but we know that misinformation spreads quicker than information, unfortunately. So you have to be really, really cautious of where you're getting your information from. What I always say is, take what you read and hear on social media, take it to your own provider who knows you and your baby the best, and then use it as a conversation starter to really talk about the things that you're hearing and sort of see how much truth that there is to those things and how it would apply to you and your pregnancy.
Yeah, and certainly a positive is that we found you through social media. There you go.
And then we can match.
Yeah, exactly. Okay, you have to explain to us what free birth is. I'd never heard of it. And do you recommend it?
Absolutely not.
Okay.
So free birth is basically, I think people are getting confused between a home birth and free birth. Free birth is going to be when you are giving birth in your own space, completely unassisted, no medical personnel there at all. And I think because of social media, there's a lot of distrust in the system. People are having traumatic birth experiences. 1 in 3 people are now reporting that they have birth trauma from their experience, either in hospital or out of hospital. So people are moving to free birth, where they are just doing it on their own. And sometimes that will also come with not having prenatal care before they actually give birth to their baby. So it can be quite dangerous. Even the World Health Organization says that we should have a medical attendant at childbirth. And so again, this is where midwifery care is really, really amazing, because they are the ones that are able to provide you with a home birth or a birthing center birth, which a lot of people are looking for, especially if they have a traumatic birth from a hospital.
Okay, and really quickly, how do you know if something is legitimate or not, what you're reading online?
I think you have to look for, are they selling something? Are they credentialed? And then basically just sort of doing a fact check around it and being like, is that? But a lot of times, if there is a lot of like fire around it, chances are it may not be the real deal. That shock factor. Yeah.
Lots to think about for sure. Mama Nurse Tina, thank you so much.
Thanks for having me.
Lady Pretty in Red over here on this Friday. Have a great weekend.
Thank you.
You can find more from Tina on YouTube, Mama Nurse Tina.